Well, thank you for joining us this evening or morning, depending on where you are. Our people from Hawaii or even early afternoon for the 2023 Society for Health Psychology Awards and Recognition Ceremony. I am Mark Vogel, the 2023-24 president of the Society. Now, some of you have participated in our ceremonies previously, usually held at convention, but everybody always had a conflict in their schedule or couldn't make it. So really to allow more members and guests to attend, we've gone virtual this year with our celebration. Now, before we begin, we have a few items to share. This event is being recorded. Anyone who speaks during its time is agreeing to be recorded and is granting permission for the recording to be posted on our website. We suggest you select the speaker view on your device, and we ask that attendees keep their systems muted during the presentations. I now turn the program over to Dr. Barbara Andersen, the past president of the Society for Health Psychology, for the 2023 Awards Committee Chair. Dr. Andersen.
Thank you very much, Mark. We're really happy to have you all here. We're excited about this. There were a few months where we were just kind of sitting on our hands, couldn't tell people who had received the awards. So this is a really special day. Barbara, I believe you have some slides with regards to the individuals that helped with awards. This would not have been possible without it takes a village to review for the awards. I mean, I think we had over 40 nominees for the various categories, at least 2, if not 3 or 4 or 5 or 6 for some of them. And so we had people from all levels. We had individuals from all of our committees. We had individuals that we invited. We also had, I think Barbara put up on the listserv an announcement that if you were interested in this. So we had a few graduate students. So that was all great too. So I just want to truly thank folks for this effort. It was really important for us to accomplish this. So thank you. Okay, let's move forward then. Our first award that we're going to be talking about is the Nate Perry Jr. Award for Career Service to Health Psychology. And this year, we actually have 2 honorees. The first 2023 honoree is Jennifer Kelly of the Atlanta Center for Behavioral Medicine. And she will be introduced by Dr. Ravi Prasad.
Thank you very much. So it's impossible to summarize the accomplishments of Dr. Kelly in 1 minute or less. So I'm going to walk you through only a few of the highlights of her very distinguished career. Dr. Kelly began working with individuals living with chronic pain at a time when few psychologists were even aware of this field. She held a role in academia before entering the private sector, where she's run her own practice for nearly 30 years. Many individuals would be content with a career that included a successful private practice, board certification, and involvement with education and teaching at a national level. But this only begins to describe Dr. Kelly's lifetime achievements. She's actively involved with the Georgia Psychological Association, where she's held many roles, including president. She's a fellow of 6 APA divisions and has had leadership positions on multiple boards, task force, and committees. She served as APA president and oversaw the council representatives as they passed 3 landmark resolutions that highlight APA's current stance on systemic racism and health equity, as well as acknowledge the organization's own complicity in promoting racism and discrimination. Her efforts have been recognized through countless awards that she's won at state and national levels. And it's with these few words that I couldn't be more proud to introduce my colleague, my friend, and the winner of the Nathan W. Perry Jr. Award, Dr. Jennifer Kelly.
Thank you, Dr. Prasad. Dr. Kelly, will you share some thoughts with us?
Yes. Can you hear me okay?
Mm-hmm.
Thank you. So, good afternoon, everyone. I would like to thank the Society and the Awards Committee for this recognition. I would like to recognize two colleagues whom I have worked closely with over the years in addressing the opioid crisis, Drs. Daniel Bruns and Ravi Prasad. My primary 2021 presidential initiative was psychology's role in achieving health equity. Addressing this issue was one of the highlights of my professional career. I am thankful for having a dedicated task force to work with, co-chaired by Drs. Keisha Holden and Jeffrey Reed. To students and trainees, it is important to set goals that will make a difference and have an impact on society. As you move towards achieving your goals, keep your eyes on the prize. Keep your goals consistent with your values, as that can help you deal with the challenges that will arise. Have a mentor and support network of colleagues who will support your work and help you manage the obstacles and barriers. I guarantee you that there will be some. I had an amazing team working with me as I pursued my goals, and I would say the association's goals. We were able to pass the Psychology and Health Equity Resolution with 100% approval from the APA's governing body. APA has continued to embrace health equity. Health is one of the 4 domains of the newly developed Racial Equity Action Plan. There is a Health Equity Ad Hoc Committee, and it continues to move forward with the action steps from the resolution. Again, I would say thank you for this recognition. I feel so honored to be recognized in this way.
Thanks so much. That was great. We have a second winner, and that is Susan McDaniel, and we will circle back around for that award in a few minutes. But now let's shift to one of our awards for senior psychologists, and this is the Excellence in Health Psychology Research Award. There are many candidates, but above them all was Bernadine Pinto, and she will be introduced by Dr. Jarita Frierson.
Thank you, Dr. Andersen. It is with great pleasure and honor that I acknowledge Dr. Bernadine Pinto being the recipient of the 2023 Excellence in Health Psychology Research Award. She is most deserving of this prestigious accolade. Dr. Pinto is currently Professor and Associate Dean of Research at the College of Nursing. I apologize for the background noise. I'm in the lobby of a hotel, so I apologize for that. But she's a Professor and Associate Dean of the Research at the College of Nursing, Health Sciences Professor and Co-Director of the Cancer Survivorship Center at the College of Nursing at the University of South Carolina. She is a prolific scholar in the fields of behavioral medicine, cancer survivorship, and exercise science. I have known, respected, and admired Dr. Pinto for over 20 plus years, and I feel privileged that I can talk about her career. Dr. Pinto is an outstanding researcher with a national and international reputation as an expert in health promotion efforts after a cancer diagnosis and in exercise promotion among sedentary adults. Given her research career, Dr. Pinto has over 120 publications in top-tier journals. With such an empirically rich and data-driven background, Dr. Pinto has become quickly sought after as a contributor and leader in national guideline efforts. She co-authored the first U.S. guidelines of exercise for cancer survivors and was one of the only behavioral scientists invited to participate in the International Multidisciplinary Roundtable on Exercise and Cancer Prevention and Control. Furthermore, as an important marker of distinction and scholarship, is international awareness, inclusion, and invitation of the scholar. Dr. Pinto was a keynote speaker at the 7th World Congress of Psychosocial Oncology in Copenhagen, Denmark in 2004, where she presented an overview of health behavior change interventions for cancer patients and survivors and provided a workshop on cancer rehabilitation at the Psychosocial Academy that preceded the World Congress. One area that I know Dr. Pinto is very proud of is being an exemplary mentor. The most distinguished productive researchers are often, but not always, generally committed to training the next generation of scholars and researchers. Dr. Pinto is no exception, as I was able to experience this firsthand, being her resident and postdoc from 2003 to 2005. In fact, Dr. Pinto was so influential in my research, I changed my research from body image, research with Barbara Andersen, to looking at physical activity interventions in breast cancer survivorship. She has also mentored so many other students and fellows and junior faculty, several who went on to receive K Awards and R1 awards as well. You can tell how fond I am of Dr. Pinto. In closing, I would like to thank Dr. Pinto for her decades of research, service, and commitment to improving the lives of cancer survivors, sedentary persons, and the many health psychology communities. You have made such a great impact on me and others that you've worked with. With that being said, thank you from the bottom of my heart, and congratulations on your award. It is well deserved. Dr. Pinto.
Thank you, Jorita.
Dr. Pinto, a few words from you.
So thank you, Jorita, and thank you, the Society, for this award. It is indeed an honor. And I do appreciate this virtual ceremony because it has given the opportunity for my 96-year-old mom, my brother, and my sister, who do not live in the US, to attend this event. So there are some pluses. I do want to share some thoughts on a question that was posed to me about one moment that shaped my career trajectory. And that happened in my case was when I was accepted to the University of Mississippi Medical Center and the VA Consortium for my internship more than 30 years ago. It was a game changer because in that time, that internship was one of the only ones that offered that required interns to spend half a day on research. And so that gave me the opportunity to work with various mentors, Dr. Pat Dubert, Tom Mosley, Tom Payne, Catherine Kerr, Phil Godding, amongst others, exposed me to different areas of research, different theories of behavior change. So really broadened my experience in the research arena. It also led to my obtaining a postdoc at the University of Brown University School of Medicine, where I mentored Jorita. And I went on to understand that I could get grant funding to provide the foundation for my research ideas and for the thoughts for the direction that I had passion for. So that was indeed a game changer for me. And the second reason was that I learned within those 12 months that being a full-time clinician wasn't quite going to be the best fit for me. So when people make decisions about internships and residencies, they can have a far-reaching effect. So with that, I want to thank again the Society, Jorita, Dr. Andersen, and my family members. We're in different time zones. Thank you all for your support, and thank you very much for this honor. I do appreciate it.
Thank you. Welcome, welcome to Bernadine's family. Thank you for being here. Our next award is for excellence in clinical health psychology, and this is a senior award. I had mentioned earlier just the pool of candidates for this and other awards was really amazing. But they couldn't hold a candle to Jeff Goody, who is our award winner for this year. Dr. Carolyn Kanzler will introduce Dr. Goody.
Hi, thank you. I am delighted to introduce Dr. Jeffrey L. Goody as this year's recipient of the Excellence in Clinical Health Psychology Award. I've known Dr. Goody since 2006, and throughout that time, he's been a mentor and a colleague who's helped shape my own career as a health psychologist and the careers of many others. Dr. Goody's efforts over the past 2 decades are inspiring and demonstrate his exceptional contributions to the health of the communities he's served as a clinician, researcher, educator, and mentor. Dr. Goody is a board-certified clinical health psychologist and professor in the Department of Family Family Medicine and in the Department of Medical and Clinical Psychology at the Uniformed Services University of the Health Sciences, or USU. He recently retired from 22 years of active duty service, including 9 years in the Air Force and 13 years in the U.S. Public Health Service. Dr. Goody has provided thousands of hours of direct clinical and consulting health psychology services to military members and their families and diverse community members. Notably, he's responded in the wake of numerous national disasters and traumatic events, providing culturally sensitive clinical health psychology interventions and trauma care. Dr. Goody is currently co-PI of a $7.3 million grant examining the effectiveness of integrated behavioral health consultants in primary care for patients with chronic pain. His works, including 2 books, more than 50 peer-reviewed articles, and 25 book chapters, have significantly shaped practice in our field. Dr. Goody is also an outstanding educator, having served 8 years as the Director of Clinical Training for USU's doctoral program in clinical psychology. He has mentored numerous students and professionals from a wide range of disciplines in clinical health psychology practice and integrated primary care. Furthermore, Dr. Goody's leadership in our field is reflected in serving in several prominent national positions, including president of the American Board of Clinical Health Psychology. So Dr. Jeff Goody truly exemplifies excellence in clinical health psychology through his innovative and distinct contributions to our discipline and to the health of the communities he serves, making him an outstanding choice for this award. So please join me in congratulating Dr. Goody.
Yay. Lovely, lovely comments. Dr. Goody, can we hear from you?
Thank you all so much. Good day, everyone. I am both honored and humbled to be the recipient of this year's Excellence in Clinical Health Psychology Award. I do want to express my deepest gratitude to the Society for recognizing my contributions to the field. This award is especially meaningful to me as I hold the Society in such high esteem for its dedication to advancing research, education, and clinical practice within health psychology. I really also want to thank Dr. Kanzler, who is an exemplary clinical health psychologist in her own right for taking the time to nominate me. Dr. Kanzler has been a dear friend and colleague for almost 20 years, and I do appreciate her taking the time to prepare this nomination. I was asked to share an invaluable lesson for today's health psychology students. And for me, although this is not an award about mentorship, for me, finding excellent mentors and colleagues like Dr. Kanzler, both within and outside the field, has been perhaps for me one of the greatest lessons and most important things that I have done. For me, a great mentor serves as a life hack for your own growth, providing experiences and insights that can accelerate your own learning curve and help you to avoid mistakes while seizing opportunities you might not have seen otherwise. And while we typically think of kind of senior mentors, I think it's important to understand and appreciate the value of peer mentors. And Dr. Kanzler certainly has been that for me. I think collaboration has often been the key to any of the successes that I've had, whether it's in clinical practice or in research. And these colleagues can provide you real-time feedback, support, and most importantly, constructive criticism that is incredibly valuable. Working closely with your peers exposes you to different styles of thinking, problem solving, and communication that have helped to enrich my skills and expanded my own perspectives. But mentorship is also a reciprocal relationship. As we think about, for students, as you gain experience, be prepared to guide newcomers. Both formal and informal settings offer avenues for mentorship and networking, and taking the time to seek these relationships are going to pay off in ways that you can't foresee even now. So along those lines, participating in professional organizations like the Society of Clinical Health Psychology offers further opportunities for networking, learning, and leadership development. These organizations provide mentorship programs, research opportunities, and conferences that connect you with field leaders, fostering both career and academic advancement. So in closing, I'd like to just take a moment to thank my many mentors. I saw Dr. Kmark on this call. Dr. Kmark gave me, Tom Kmark gave me my first opportunity to get involved in health psychology. He hired me as a research assistant at the University of Pittsburgh, and I am forever grateful, as he was a key to me getting started in my career. And of course, I want to thank my graduate school mentor, Dr. Kevin Larkin, as well as my many peer colleagues, who many of whom are past recipients of this award as well. Their guidance has been invaluable in shaping my career and helping me achieve milestones that have helped lead to this award. So I'm grateful to my mentors, my colleagues, and their unwavering support for continuing to push me towards excellence. Thank you.
Thank you. Great comments. And a wonderful segue to our next award, which is for excellence in health psychology mentoring. And it's to be presented to Vanessa Malkarn of San Diego State and the University of California at San Diego. As is often the case in this award category, numerous mentees combine to nominate Dr. Malkarn. But today, Dr. Rena Fox will introduce the recipient on the behalf of her many trainees. Rena.
Thank you. Thank you so much, Dr. Andersen. For the past 30 years, Dr. Vanessa Malkarni has served as a shining example of what health psychology mentoring can and should be. At San Diego State University, she's chaired more than 70 theses and dissertations for undergraduate through doctoral students and has served as a committee member for countless more. From 2015 to 2022, Dr. Malkarni was the principal investigator for the NCI-funded Creating Scientists to Address Cancer Disparities program, which aimed to advance the careers of underrepresented minority students completing their undergraduate education who expressed interest in cancer disparities research. Through this program, Dr. Malkarni personally supported the professional development of approximately 200 underrepresented minority undergraduate students, many of whom went on to pursue graduate study, frequently in health psychology. Dr. Malkarni's trainees have gone on to myriad careers in health psychology spanning research, teaching, clinical practice, and advocacy work, significantly expanding the legacy of her mentorship. Dr. Malkarni is a warm and supportive mentor. Anybody who's met her can see this quite easily, and she's an outstanding role model as a woman in academic leadership. She works tirelessly to create an environment in which mentees feel safe expressing their thoughts and asking questions without fear of retribution or consequence. She's made it clear on many occasions that her greatest source of pride and truest personal mark of success is the success of her mentees, however they may define it for their own professional goals. This is a testament to how Dr. Malkarni approaches mentorship. I am but one of the countless mentees, many of whom are logged on here today, who's had the distinct honor and privilege of learning from her. And I am extremely honored to introduce this year's recipient of the Excellence in Health Psychology Mentoring Award, Dr. Vanessa Malkarni.
Yay. Great comments. Thank you so much. Dr. Malkarni, you're on.
Thank you, Rena. Thank you for that lovely introduction. I want to thank the Society for Health Psychology for this honor. It means a great deal to me. And also special thanks to all of my former trainees who nominated me for this award and are here today. And like Dr. Pinto, I also want to say how much I appreciate the Zoom format because my 89-year-old mother is on, along with some of my other family members. So I wanted to briefly address the Society's prompt about asking where I found unexpected inspiration for my work. I found expected inspiration through focusing on the accomplishments of my students. And it's not that I didn't expect to be inspired by my students, I definitely did, but rather I never realized how much my students' accomplishments would become central to my own sense of how I could make a difference in the world. So when I first started my career more than 3 decades ago, I was focused on developing a health psychology research program with the goal of making important discoveries that would improve human well-being. And while, of course, I've never abandoned that goal, it became increasingly clear to me with each passing year that some and perhaps most of my own work will be eclipsed or made obsolete by the work of future health psychologists. So that perspective may sound a bit dispiriting, but I actually found it simultaneously humbling and inspiring. And it led me to increasingly direct my efforts towards training and mentoring the future generations of health psychologists. And today, there's nothing that I find more inspiring than following the accomplishments of the students and the trainees that I had the privilege to mentor, a number of whom, like I said, are on today, and it's very nice to see all of you. They will make new discoveries. They will move the field of health psychology forward. They will improve human well-being. And I can derive tremendous satisfaction from having played a small part in helping prepare them to make a difference in the world. So thank you to the society, thank you to my family, and thank you to all of my mentees. I am most honored.
Thank you, Dr. Malcarney. Great words. Thank you very much. The next award is the 2023 Cynthia Bellar Award for Excellence in Health Psychology Education and Training. This year it's presented to Ronald Rosinski of the University of Florida. On behalf of his fellow nominators, Dr. Sharon Berry and Richard Syme, I'm sorry, I can't see this, Dr. Stephen Tovian will give the introduction. Stephen?
Thank you. Dear friends and colleagues, it's my great pleasure and honor to offer these remarks on behalf of Dr. Rosinski in receiving the Cynthia Bellar Award for Excellence in Health Psychology Education and Training from our society. An excellent word to describe Dr. Rosinski would be consummate. He is a consummate scientist practitioner in the field of health psychology. He has also been a consummate leader in psychology's education and training community, making major contributions to graduate students, interns, postdoctorate fellows, and peers in health psychology, locally, nationally, and internationally. Dr. Rosinski is a fellow of our society and board certified in clinical health psychology. He is professor and past chair of the Department of Clinical and Health Psychology at the University of Florida, Gainesville, with its APA accredited doctoral and internship programs in both clinical and health psychology. He has worked collaboratively with Dr. Cynthia Bellar, who is the program's director of clinical training, as well as his associate chair of education until she relocated to the APA as executive director of the education directorate. At the University of Florida, Dr. Rosinski also served as the College of Public Health and the Health Professions Associate Dean for International Programs. He served 2 terms as our division's representative to the APA Council of Representatives, serving on our society's executive committee for 6 years. During his term on APA Council, he was instrumental in having APA recognize the importance of population health as part of psychology's educational, scientific, and practice and public health responsibilities. Dr. Rosinski has been awarded the Raymond D. Fowler Award for Outstanding Contributions to APA and the Carl F. Heisler Award for Advocacy on behalf of professional psychology. He has garnered awards on numerous occasions for his undergraduate and graduate teaching and supervision excellence at the University of Florida. His academic leadership resulted in his department receiving 3 prestigious national awards from APA for education and service in psychological science. Dr. Rosinski has also received APA Division 52's, the International Psychology Division, Award for Outstanding International Psychologist for his outstanding work and health psychology training in the United Kingdom and the Kingdom of Jordan. Nationally, Dr. Rosensky was appointed to the U.S. by the U.S. Secretary of Health and Human Services to the Advisory Committee on Interdisciplinary Community-Based Linkage of the Bureau of Health Professions. He was the first psychologist to chair that committee. He has been a tireless advocate for psychologists' roles as team leaders in medical and mental health hospitals throughout his legislative testimonies and many publications. He has supported psychologists in being recognized as salient members of professional medical staffs. Dr. Rosensky has written 5 textbooks, over 20 book chapters, and 85 peer-reviewed journal articles on the science and practice of health psychology education, and health policy. He was founder and editor for 13 years of the Journal of Clinical Psychology in Medical Settings, which is approaching its 13th year of publication. In summary, Dr. Rosensky has received numerous prestigious and distinguished national and professional awards for his teaching, academic scholarship, practice, and advocacy for health psychology. He was recognized by an APA presidential citation for being a tireless advocate on behalf of psychology's contribution to healthcare. Last but not least, Dr. Rosensky is a consummate friend and trusted colleague to so many, as well as a superb sailor second to none. Dr. Rosensky has made tremendous positive impact on our profession in so many ways and embodies all that the Cynthia Billar Award for Excellence in Health Psychology Education and Training represents. Congratulations, Dr. Rosensky, for this well-deserved award.
Thank you so much. Lovely, lovely comments. Now, Dr. Rosensky.
Well, thank you very much. Thank you very much,
with us.
Steve. Thank you, Steve. And I'll just correct you. It's the 30th year of the journal. You don't want to admit how old we've gotten. I would like to thank the members of the Society for your kind recognition of my contributions to education and training in health psychology. I sincerely thank my dear friends, Dr. Sharon Berry, Rick Saimi, and Steve Tovian, for nominating me for this wonderful award. And to my good friend and monthly lunch partner, Dr. Cynthia Billar, thank you for your leadership as the role model for building the future of education and training in health psychology. And of course, best wishes to my fellow Division 38 awardees for this year, a truly accomplished group of friends. So we were given a choice of questions and issues to respond to. So I chose that I would say something to the students. So to our students, interns, postdocs, I offer this lesson regarding the future of health psychology. Be bold, learn everything that is necessary to assure that both your own professional autonomy and the independence of health psychology is taken care of in all education, training, research, and healthcare settings, community colleges, universities, academic health centers, hospitals, clinics, and community. Wherever you are, build independent departments of psychology. Very important. Be truly interprofessional, but be competent psychologists first. Remember, we work with patients, not clients. Very important for health psychology to remember that and use that language in the world in which we do research and practice. Be leaders who are proud to call yourself psychologists and base your competencies as scientists, clinicians, and colleagues on psychological science, and importantly, those professional characteristics that make you a compassionate individual. Again, thank you all for this award, and to my friends who nominated me, thank you very much. Thank you.
Thank you, Ron. Thank you, Ron. Now, this is a newer award. The first one was given last year. The name of the award is the Barbara A. Keaton Award for the Volunteer of the Year. And as our named award and our fearless leader, Dr. Keaton, would you like to present the award?
As anxious as I am to get on with this, and I will take my turn in just a moment, I know that Dr. McDaniel's with us now, so perhaps we want to go back and give a chance to present the Nathan Perry Award, and then it'll be my turn.
Okay.
Okay.
So Dr. Susan McDaniel, the second individual to receive the Nathan Perry Award for career service to health psychology. And for that award, she will be introduced by Dr. Nancy Ruddy.
Hello, everyone. I'm so happy to introduce my mentor and friend of over 30 years, Susan McDaniel, as she receives the Society for Health Psychology Nathan W. Perry Jr. Award for Career Service to Health Psychology. To be clear, I was 10 and she was 15 when we met, so we're very young. I cannot imagine a psychologist more deserving of this award in the context of her professional and academic contributions, governance roles, and history of mentoring and educating others. Susan has made valuable contributions in the fields of psychology, family therapy, family medicine, and healthcare professional education. These contributions and achievements have been widely hailed both within the field of psychology and by other professional groups. Within the long list of awards, the fact that the Society of Teachers of Family Medicine not only awarded Susan a Career Achievement Award, but to decide to name the Career Achievement Award after her says it all. It is an understatement to say that Susan has well represented the field of health psychology across a range of healthcare professional organizations. Susan's academic achievements are clear given the pages and pages of publications and presentations in her vita. What makes Susan's achievement all the more impressive is how she has woven her passion for helping families cope with health and illness and her academic pursuits. She literally helped establish 2 new subfields based on the needs she identified through the clinical practice of psychology and family therapy and primary care. First, with the publication of her seminal book, Medical Family Therapy, and subsequent work, Susan defined the conceptual structures and clinical techniques of the now robust field of medical family therapy. In so doing, she melded health psychology and family psychology in a manner that has benefited psychologists and those they serve for decades. Second, she worked tirelessly to promote the integration of behavioral health and psychology into primary care settings. This work helped to set the stage for a national wave of primary care practice transformation in which psychologists work side by side with primary care medical providers. This transformation not only meets clinical needs of the patients we serve, but has created a whole new set of opportunities for psychologists in primary care settings. She has achieved all of this while holding high-level administrative positions at the University of Rochester School of Medicine and Dentistry. No surprise, she's used her position to create dozens of roles for psychologists in primary and specialty care. She's developed a physician coaching process and practice that applies psychological science and communication and leadership. She has developed robust interdisciplinary training opportunities for trainees and early career professionals. Throughout this time, she somehow managed to maintain a continuous patient practice and ground her work in the needs of the public we serve. Susan's level of service to the field of psychology is unparalleled. I bore witness to her time at APA president and was continually amazed at her willingness to truly sacrifice her own personal and professional well-being to help the organization navigate the challenges of the Hoffman Report and subsequent disruption. The 3-year arc of her presidency was a grueling capstone to her service. Yet, as this arc ended, Susan continued her service as the council rep for the Society of Health Psychology. She also continues to serve as the president of the Clinical Practice Division of the International Association of Applied Psychology. I continue to be truly amazed by her willingness to maintain engagement despite the ongoing challenges. On a more personal level, I've had the honor and privilege of working with Susan since the early 1990s. I've personally and professionally reaped the rewards of her mentorship, as have countless others. Susan always makes time to support other professionals, always seeks developmental opportunities for others, knowing when to push and when to give space, and values long-term relationships. I feel blessed that I've had her as a mentor, and I know that I would not be where I am without her support and guidance, and there are many other people who would say the same. Thank you.
Thank you, Dr. Ruddy. Dr. McDaniel, your comments?
Thank you very much, Nancy, and for leaving out the many embarrassing moments you could have shared with all of our colleagues. So good afternoon, fellow health psychologists. First, I do want to thank the Society for this wonderful recognition. To have an award named after one of the founders of our discipline, Nate Perry, makes it especially meaningful. I want to share two moments that shaped my career trajectory and influenced my receiving this award. The first came early in my career when I was an intern and then a postdoc with Harry Galishan and Harleen Andersen at the University of Texas Medical Branch in Galveston. Harry and Harleen turned me on to systems theory and the importance of paying attention to the effect of relationships on health outcomes and of health on relationships. Working with them was incredibly exciting and inspiring. When I went to one of my first APAs with Harry, he asked me if I'd like to go to a Division 43 board meeting with him. He was representing the Division on Counsel. Harry was one of the pioneers of family therapy, a brilliant clinician who could tell me more about my patient just walking by him in the waiting room than I could after 4 hours of psychological testing. And that's a true story. He was gifted, but patience was not one of Harry's virtues. So when I went to this board meeting, which lasted all day, I was shocked to sit through one of the most boring things my young ears had ever experienced. I could not believe that the brilliant inpatient Harry was spending his time on this stuff. Not that I really understood what was going on, but I had my opinions nonetheless. So at the end of the day, I said, Harry, that was so boring. Why in the world do you do this? And he said something I've never forgotten. He looked right at me and said, Susan, if we don't do it, who will? I knew that minute that Harry was giving me a life lesson, passing on some responsibility that was important. Did I want to be a change agent or not? I honestly had no ambitions for any kind of political office. But when Nate Perry's wife, Suzanne Bennett Johnson, a great health psychologist and a great APA president, started working on me saying, we need another health psychologist as president of APA, and it should be you. I heard Harry's voice in my ear. Susan, if we don't do it, who will? Now, you may be wondering why I'm talking about Harry Galishan, a pioneering family psychologist, when getting a wonderful award from the Society of Health Psychology. It's because I credit Harry and Harleen with teaching me systems thinking. When I went to the University of Rochester, after just completing my postdoc, I had the good fortune of working with and being inspired by George Engel, the father of the biopsychosocial approach. Both the biopsychosocial approach and family therapy have roots in the general systems theory that swept much of science in the early 20th century. But other than the relationship between the physician and patient and psychology and biology, George did not really focus on interactions between the various levels of the biopsychosocial approach. So when I asked George why specifically he didn't attend more to family relationships as they clearly affect health outcomes, he said, Susan, that's for you to do. There it was, another moment just like that from Harry, where I felt the responsibility clearly being passed on to me. And now the combination of systemic approaches and biopsychosocial medicine represent my life's work. And it's why I said yes to Nancy Ruddy about joining her to write a book on systemic integrated care, which will be published by APA in January. So I say to you now, when it comes to our society and our discipline, if we don't do it, who will? What needs to be done next that's for you to do? I look forward to finding out.
Thank you so much. Great comments. And now I'm going to return to Barbara Keaton to talk to us about the award for 2023 Volunteer of the Year.
Thank you very much. So 3 years ago, I suggested that the Society for Health Psychology needed a mechanism to recognize leaders who really go above and beyond the normal excellent volunteer service on our councils, committees, interest groups, and task forces. And then I was surprised 2 years ago, to have the Volunteer of the Year award named for me. So now I have the honor of introducing the 2023 recipient, Dr. Allie Weinstein. For those of you who have been in positions where you have to ask other people to give their valuable free time, you know that even reasonable people must occasionally decline your invitation to serve. Yet there are always some folks who are consistently willing to say yes, and Allie is one of those people. She first joined the Society Board of Directors in 2005 as Student Council Chair, and has actively participated in nearly every aspect of society service and leadership ever since. After serving many years as a council member, she spent the past 6 years as chair of the Health Research Council, coordinating not only general council management, but also annual programming at APA, webinars, and graduate student research awards. She served on the Nominations and Elections Committee and simultaneously agreed to lead the board and membership pillar of the 2021 Long Range Planning Task Force and to serve as the Health Research Council representative to the awards committee. Meanwhile, she had her professional duties as professor in the Department of Global and Community Health and as a senior scholar at the Center for the Advancement of Well-Being in the College of Public Health at George Mason University, where by all reports, she's a valued mentor, collaborator, and colleague. Her scholarship and impact have been recognized by APA and SfHP with fellow status. The Society for Health Psychology and I want to thank Dr. Weinstein for her remarkable professional generosity and achievements, and we look forward to her continuing participation in the years to come.
Thank you, Barbara. Dr. Weinstein.
Hi, so first off, thank you so much. And I just want to say to any trainees out there, particularly if I have any trainees of mine out there, we talk about when to say yes and when it's okay to say no. And we have to make that on a case-by-case decision. It's always easy to say yes to the Society of Health Psychology. I don't ever regret spending a bunch of my extracurricular time with the Society because it is so meaningful. So I was asked to maybe comment on the value of volunteer service in the Society. And I can say that it really has benefited me professionally in many ways. So first, I've been able to really interact and work with amazing people that I wouldn't have gotten to interact or work with regularly. And I've been really able to extend my network of colleagues with my volunteer service to the Society. I work in a College of Public Health in a Department of Global and Community Health. So there are not many psychologists in my building. So to be able to have colleagues of like mind is really so valuable, and I feel so lucky. In addition to that, I was able to really meaningfully contribute to enhancing the supports available to our next generation of health psychologists. So for those interested, the Health Research Council is a wonderful place to really get to engage with our future researchers in terms of our graduate student awards, and we'll get to hear about them in a little bit. And truly, in the end, my volunteer service has allowed me to find my professional home with the people that I'm honored to call colleagues. This was an extremely meaningful honor to me, and I really appreciate it. Barbara Keaton, who I have known since I was a graduate student, I think I've spent almost monthly calls on the phone with her since 2005, potentially, is a wonderful, thoughtful, caring individual, and the idea that my name is linked with hers in any way is really an honor I can't express. So thank you again to Barbara, and thanks to the Society.
Thank you. Thanks so much, Allie. Next, we're going to shift to Early Career Professionals Awards, and we'll begin with 2 awards for excellence in health psychology research by an early career professional. I had mentioned how incredible the nominees were, and when it was choice, we could not make a choice. And so we are very happy to have 2 awards. And the first will be presented to Eric Kim of the University of British Columbia by Dr. Bill Chapek.
Everybody, really nice seeing everybody. So I am thrilled to announce Dr. Eric Kim, as Barbara said, who's an assistant professor of psychology at University of British Columbia, Received his PhD from University of Michigan before spending some time at Harvard as a research fellow, associate, and scientist for 5 years. So for those that don't know, his program of research aims to identify, understand, and intervene upon the dimensions of psychological well-being that reduce the risk of age-related conditions. In just his early career, Eric has amassed nearly 100 publications, multiple grants, and is considered a thought leader in multiple intellectual spaces in terms of health psychology. Underlying this description is a commitment to maximizing human wellness and health, with a particular eye towards public health considerations and identifying the malleable characteristics that move us closer to that goal. More personally, he's one of the nicest people I know. He sees the best in others, inspires people to be better, and is driven by uncovering the mysteries of public health while championing the potential insight of others in the field to further this cause. Lifting others up to achieve amazing things is one of his largest character strengths, in my opinion. So I've known Eric for nearly 15 years, so it's my pleasure to introduce and congratulate him on receiving Division 38's Excellence in Health Psychology Research by an Early Career Professional. Congratulations, Dr. Eric Kim.
Yay. Thank you so much. Wonderful comments. Dr. Kim, how about some reflections from you?
Thank you. I'm really deeply honored and grateful to society for this recognition, and I wanted to respond to the prompt, one moment that shaped my career trajectory. And that was actually my first year of college at the University of Michigan when I met my first mentor, Chris Peterson, and he really ignited my fascination around the concept of purpose in life and introduced me to the transformative works of people like Viktor Frankl. And these kinds of texts were like a Rosetta Stone for me because they actually brought to light, helped translate the experience of older relatives of mine who seemingly lost their sense of purpose and after retirement, and which in turn might have led to declining interest in taking care of their health. And under Chris's guidance, I pursued my PhD, and the topic of purpose was a recurring focus of our discussions. He actually had an untimely and tragic death during the middle of grad school, and that was a deep loss for everyone. But over time, I found solace and guidance in the collective wisdom of other wonderful mentors like Jackie Smith, Carol Riff, Vic Strecker, Rich Gonzalez, and Tony Antonucci, who fostered my personal and professional growth. And during this time, I also had the wonderful chance of meeting one of my best friends in life, Bill Chapik, who's been an incredible friend and collaborator throughout. After graduating, I pursued a postdoctoral fellowship at the Harvard School of Public Health and had the wonderful opportunity to expand my perspectives further under the guidance of another team of tremendous mentors. I want to thank Laura Kubsiansky, Tyler Vanderweel, Ichiro Karachi, and Fran Grodstein. And I hold a deep sense of gratitude towards each of them and will always cherish the insights and guidance they provided. Thank you so much.
Thank you. Thank you. And so our second awardee in this category of contributions by an early career professional is Dr. Rebecca Reed of the University of Pittsburgh, and she'll be introduced by Dr. Tom Kamark. Tom?
Thank you. Dr. Reed is an assistant professor of psychology at the University of Pittsburgh. She received her doctorate degree in family studies and human development with a minor in quantitative methods at the University of Arizona, and she completed a postdoctoral fellowship at University of Kentucky shortly thereafter, where she applied for and received on her very first try a Pathway to Independence Award, a K99 R00 from the National Institutes of Aging, a grant which has funded much of her initial work as a junior faculty member at the University of Pittsburgh. Dr. Reed investigates the links between psychological stress, psychosocial resources, and biological aging. She has shown, for example, that stress is associated with inflammation and lymphocyte senescence, and that social support is associated with a slower pace of epigenetic aging in midlife and older adults. Dr. Reed has published 30 refereed journal articles and book chapters, and she is the recipient of 4 research grants, including the Pathway to Independence Award. The trajectory of her accomplishments since coming on board as a faculty member at the University of Pittsburgh belies the challenges and obstacles that she faced as a new tenure stream faculty member starting a research laboratory in the midst of a global pandemic. As the pandemic unfolded in 2020, it became clear that Rebecca would have to substantially revamp the data collection plans associated with her grant award to permit her to collect data in a fully remote manner. Despite these obstacles, she was still able to expand the focus of her work to include novel epigenetic markers, and she was able to stay on schedule with respect to the rate of data collection as part of this project. In this respect, she's to be commended for her dedication, resourcefulness, and resilience. Dr. Reed brings an impressive collection of skills to bear on her work. With her extensive background in physiology, human development, emotion science, and longitudinal quantitative methods. She's also a very compelling teacher, just a very nice person, a dedicated mentor, and a generous colleague. She's richly deserving of this honor in recognition of her exciting and innovative work.
Thank you, Tom. Thank you, Tom. Dr. Reed, we look forward to your comments.
Thanks so much, Tom, and thank you. I'm very honored to receive this award and want to express my sincere thanks to the Society for Health Psychology and its members and the award committee. As part of our remarks, we've been asked to describe one moment that shaped our career trajectories, and mine was taking Dr. Mary Frances O'Connor's psychoneuroimmunology course at the University of Arizona during my PhD program. Light bulbs went off for me in this course where I discovered the world of PNI, and it's been thrilling to contribute to this area and integrated aspects of aging and quantitative methods to study how biopsychosocial factors affect immune aging and biological aging over time. I've had wonderful mentors, collaborators, and students along the way, and in particular, I'd like to acknowledge my late graduate mentor, Emily Butler, my postdoc mentor, Suzanne Segerstrom, and my outstanding colleagues and mentors at Pitt, including my nominator, Dr. Tom Kmark, as well as Drs. Anna Marsland, Steve Manick, and Pete Generos. And finally, I'd like to thank the members of my psychoneuroimmunology research lab at Pitt, who I look forward to working with every day to continue contributing to the PNI field. Thank you very much.
Thank you. Great comments. And so kind of the parallel award, the 2023 Award for Excellence in Clinical Health Psychology by an early career professional is presented to Casey Kavanaugh of the University of Virginia School of Medicine by her colleague, Dr. Joanna Yost. Joanna.
Thanks so much. I have the distinct privilege of speaking about a truly exceptional individual, Dr. Casey Kavanaugh. Dr. Kavanaugh is a board-certified clinical health psychologist and an early career professional whose passion and dedication have been instrumental in improving the lives of countless individuals, especially within underserved populations. Since joining the UVA School of Medicine as an assistant professor in 2019, Dr. Kavanaugh has made a significant and meaningful impact within our institution at UVA. Her efforts have spanned three critical areas: cardiovascular behavioral medicine, transplant, and consultation liaison. Within cardiovascular behavioral medicine, Dr. Kavanaugh has spearheaded the development of inpatient and outpatient health psychology services for patients with cardiovascular disease. Dr. Kavanaugh has also played a pivotal role in significantly expanding the services offered to transplant patients in both the acute and intensive care settings in our hospital. Her dedication also extends to patients with alcohol use disorders preparing for liver transplants, ensuring their access to crucial health psychology services. As if this isn't enough, Dr. Kavanaugh also serves as the co-director of the Behavioral Medicine Consultation Liaison Service and has played a critical role in helping secure funding and significantly enhancing the hospital's capacity to provide essential services to patients in our acute and intensive care units. Her leadership in this area has not only benefited UVA, but has also informed the development of similar models at other institutions. Beyond her clinical contributions, Dr. Kavanaugh has engaged in quality improvement projects and research endeavors that reflect her commitment to patient-centered care. Furthermore, in the face of challenging times, Dr. Kavanaugh has repeatedly risen to the occasion as a clinical health psychologist. She rapidly developed and implemented services during the COVID-19 pandemic and provided critical support to the UVA community following a shooting at UVA in 2019. She's demonstrated her leadership at the broader level, holding key positions in prestigious organizations such as this one, as well as the Society of Behavioral Medicine's CVD Special Interest Group. In recognition of these outstanding contributions, I'm thrilled to present Dr. Kavanaugh with the Society for Health Psychology's Excellence in Clinical Health Psychology by an Early Career Professional Award. Her record of achievement, dedication, and her vision for the future make her a shining example of excellence in clinical health psychology. Congratulations, Casey.
Thank you so much, Dr. Yost. Dr. Kavanaugh, would you like to share some thoughts with us?
Sure, I'll try to keep these brief. I would just thank you, Joey, for nominating me. And then I would like to say I'm obviously very grateful for this honor and thankful to the Society. I'd also like to thank all of my mentors, including Kevin Larkin and Matt Berg, for their invaluable guidance. And then in response to the prompts, I would just like to offer one lesson to health psychology students and trainees. That is to pursue opportunities. For me, I've been eternally grateful for the clinical and research fellowships I completed. I gained so much from those opportunities, most importantly, the mentorship and the collaborations. I've also valued the opportunities to contribute to my professional organizations like the Society. These opportunities have provided me with valuable connections to other colleagues and to give back to the field. I strongly encourage health psychology students and trainees to look for opportunities that will challenge them and help them grow as successful future health psychologists. Thank you once again.
Thank you so much, Dr. Kavanaugh. And now we're going to shift to look at the Graduate Student Research Awards, and Dr. Weinstein is going to help with that.
Thank you. Appreciate it. So these research proposals that we're recognizing today were submitted to the Graduate Student Award Program, and they are selected by the Health Research Council. Each of these receive $2,000 in research support from the Society. And we also want to acknowledge that this is a yearly event. So if you have any potential applicants that would like to apply for next year's awards, the deadlines are January 31st, 2024, and there's an informational webinar in November to give you all the details. All the registration details will be posted on the Society listservs. But for 2023 awardees, we have awards in general health psychology and in health disparities, as well as a research award to promote inclusion, which provides a graduate student from an underrepresented group with funding to allow them to successfully complete a health psychology relevant research project. So I'm happy to get to announce the research award winners. And I'm just going to caveat with, I apologize if I mess up anyone's name. I'm always Ali when I first meet people, so I understand. And but the work was amazing. I am happily one of the reviewers, along with the rest of the Health Research Council, and this is some amazing work by these graduate students. In the general category, our first award goes to Cheyenne Reyes from the University of Rhode Island for a study on a mixed method study of compassion fatigue in the US general population. We have Elise McKelvey from Augusta University for her work, CBT-based group intervention for patients with functional neurological disorders. We have Hurrier Denise Cocox, the New School for Social Research, for a study on the exploration of the relationship between endometriosis, stigma, menstrual stigma, and depression. And Riley O'Neill from the University of Arizona for an integrated model of environmental safety, and social vigilance as psychosocial contributors to cardiovascular disease. The 2023 Health Disparities Award goes to Alexis Grant from the Purdue University in Indianapolis for the work Assessments of Opioid-Related Risk in Diverse Patients with chronic pain. Should I, Barbara, am I right? Or the slides?
You're right.
Okay, even better. Always like to be more correct than the slides. So again, Alexis Grant from University of Indiana University, Purdue University in Indianapolis. She did work on assessments of opioid-related risk in diverse patients with chronic pain, race and gender disparities. And the final award for our Researcher Inclusion Award was given to Stephen Marsiglia from the Arizona State University for work on health access for Native Hawaiians and Pacific Islanders, determinants of health service utilization and insurance coverage. So again, my heartfelt congratulations to all the Society's 2023 Graduate Student Award winners. I just want to take a moment to say thank you to all the applicants that applied and also to all of the reviewers. So each of these grants were reviewed by at least 2 to 3 reviewers. So the Health Research Council really does a wonderful job reviewing. And thank you. And I'm looking forward to the results of all this wonderful research. Now we're going to take a moment for some special recognitions of society members. So I'm going to turn it over to Dr. Barbara Ward-Zimmerman, who was our 2022-2023 SfHP president.
Thank you, Alan. Thanks so much. One of the initiatives identified in the awards and recognition category of the Society's recently updated long-range plan was bringing the accomplishments of health psychologists to the attention of more of our psychology and healthcare colleagues by nominating members for APA and other organizations' awards. In keeping with this initiative, at the recent convention in Washington, D.C., Dr. Daniel Bruns was recognized with one of the 2023 Carl F. Heiser Presidential Awards for Advocacy by APA President Dr. Tima Brandt. I'd like to share a few thoughts from the letter of nomination written by the Society's presidential trio in collaboration with Dr. Rob Glukoff, the inaugural and longstanding chair of the Interdivisional Healthcare Committee, on which Dr. Bruns serves. I am delighted that our esteemed colleague, Dr. Daniel Bruns, was chosen to receive the prestigious Carl F. Heiser APA Award for Advocacy. The award places Dr. Bruns among the ranks of psychology's most influential leaders, and we are immensely proud of his achievement. For context, the Heiser Award honors psychologists who have given voluntarily of their time to define and advocate for the discipline of psychology. Carl Heiser was a visionary who translated his ideas into reality, and the same can be attributed to Dr. Bruns. Leveraging his vast expertise and influence to drive positive changes in healthcare, his successful advocacy work has been executed in collaboration with local, state, and national organizations. Dr. Bruns is the consummate interprofessional collaborator. More specifically, his advocacy efforts have resulted in policy changes informing and promoting best practice by both the medical community and fellow psychologists. His exceptional ability to communicate complex psychological concepts to policymakers has been instrumental in shaping evidence-based medical treatment guidelines, incorporating a biopsychosocial framework at their core. In coordination with other impactful psychology colleagues, Dr. Bruns facilitated the use of health and behavior CPT codes by psychologists, allowing billing for services involving the assessment and intervention of behavioral, psychological, and social factors affecting an individual's health. Importantly, Dr. Bruns was instrumental in advocating for bills addressing the opioid epidemic, establishing guidelines for prescribing and managing opioids in workers' compensation cases to reduce the risk of addiction and improve patient safety. Serving as a template, his work has been used nationally by workers' compensation systems and by the U.S. Department of Defense. Dr. Bruns is currently advising the American Medical Association on integrating psychometric methods into their protocols. For example, standardizing assessment of functioning in electronic health records. In light of Dr. Bruns's commitment in advancing the field of psychology through advocacy, he is so richly deserving of the Carl F. Heiser APA Award. His outstanding and effective advocacy efforts, leadership, and unwavering dedication to the betterment of society and the profession of psychology make him an exemplary awardee. Few psychologists have achieved the level of advocacy impact reached by Dr. Bruns. And now we are going to hear a few words from Dr. Bruns.
Thank you so much, Barbara. That was very, very kind of you. This award came as quite a surprise to me because I didn't know I'd been nominated until a couple of weeks before I received it. And so I was kind of taken aback by that. So I want to thank Barbara Ward Zimmerman and the other division presidents who all collaborated in this regard, and Rob Glukoff, who nominated me. This was kind of a double surprise because I had to ask myself, am I a good advocate? The thing is, I haven't thought of myself as an advocate for some agenda. I've thought of myself as an agent of change, somebody who tried to make a difference, to make things better, and actually tried to solve other people's problems, look at the things on their agenda. How could we address those? And so I've tried to collaborate with others to make things better somehow, to leave the world in a little bit better place than I found it. I also want to express the fact that I didn't do this in a vacuum. I had other collaborators, several of whom are present on this call. And that includes Rob Glukoff, Ravi Prasad, Jennifer Kelly, Barry Nierenberg, Nancy Ruddy. They're all people I've collaborated with over the years, all good friends. And it's been a labor of love working with them to try to make a difference. So thank you again for this award. It is truly a profound honor for me.
Well, we thank you, that's for sure. And in October, Dr. Bruns is going to do a webinar for us for the division, which will be wonderful to hear. And yeah, we'll talk more about advocacy at that time. Now I have one more remaining task as the 2022 to 2023 Society President. And this one is truly a pleasure. I would like to recognize a long-serving member with a Society for Health Psychology presidential citation. This citation honors Dr. Rob Glukoff. The Society for Health Psychology is pleased to recognize the exceptional service of Dr. Rob Glukoff as founder of the Interdivisional Healthcare Committee, otherwise known as the IHC, and serving as its chair for over 20 years. The IHC is comprised of representatives from multiple APA divisions and groups, including the Society for Health Psychology, yet functions as an independent think tank that advises APA on issues relating to psychology's role in healthcare. Under Dr. Glukoff's leadership, the IHC has helped see the creation of the Health and Behavior, now HBAI CPT codes, facilitated the formation of formal coalitions with medical societies, encouraged policy discussions, curriculum development, and creation of treatment guidelines, excuse me, and made recommendations regarding the World Health Organization's International Classification of Functioning. While the above is just a small sample of the IHC's accomplishments over time, none of this would have been possible without the selfless stewardship of Dr. Glukoff. When not leading the IHC, Dr. Glukoff does extensive work in the community helping the underserved. More specifically, he trains paraprofessionals in Black churches in Florida to provide support to those caring for spouses with dementia, as these individuals tend not to use traditional medical services. They would be at a loss if it were not for Dr. Glukoff's efforts. The Society is grateful to Dr. Glukoff for his professional dedication across the multiple domains, and we wish him all the best in his future endeavors. I'd like to thank Dr. Ravi Prasad for preparing the text of this citation. And we did not inform Dr. Glukoff in advance that he would be recognized today. We wanted to surprise him. But Dr. Glukoff, who's rarely at a loss for words, If you would like to say a few words now, you are most welcome.
Well, needless to say, I'm grateful. I'm surprised. I had no idea that I would receive the award. It's so thoughtful of the Society of Health Psychology for conferring the presidential citation. I'm very grateful for the opportunity to have served APA, the division, through the entity of the Interdivisional Healthcare Committee. We actually began in 1996. And 27 years later, we're still going strong. I think you heard that the IHC has helped to contribute to professional psychology in developing the health and behavior codes and forwarding science and shaping the AMA guides, which of course I attribute 100% of that effort to Dr. Dan Bruns, and as well as some work that we did. I also wanted to mention that the IHC was involved in the evaluation of the international classification of functioning. We had a strong role in that, and that was quite rewarding. So thank you very much. I'm not sure, I think I'll leave it at that. Thank you so much.
Well, thank you. We really appreciate all that you have done and all you'll continue to do. So truly, we're very appreciative. I also just want to quickly say what an accomplished group of awardees, and I want to congratulate also everyone who received an award today. And it's just amazing, the wide-ranging and remarkable contributions that you have all made to health psychology. So with heartfelt thank you. Now I will turn the mic back over to Dr. Andersen, who will close the awards portion of today's ceremony. You're muted, Barb.
Thanks. I will echo Barbara Ward-Zimmerman's comments. I appreciate all the work that went toward nominating individuals. I mean, that's really an important task, actually, that scholars and clinicians, somebody has to embrace this task to put people forward. And I encourage you all to consider that going forward and kind of mentor other individuals to embark on that. It's really an important effort. So thank you all, awardees. Thank you all, nominators and individuals providing comments. They were all heartwarming, lovely, and just really importantly informative about the many accomplishments of the awardees. So thank you so much. Really enjoyed this. Dr. Vogel?
Great. Well, I want to conclude with just another comment to remind everyone really what a fantastic job Dr. Andersen did in putting this whole thing together. She really took it to heart to make this a really well-organized review process. And I also want to thank anybody who nominated someone who maybe wasn't awarded today. Thank you, and maybe nominate that same person again, because again, such amazing people getting the awards today. It really speaks to the strength of the organization. So now, before we end our ceremonies tonight, one of our traditions each year is to welcome what we call maybe future health psychologists. And so I have a pleasure of talking a little bit about Lillian Nell Gross, who is the child of Chase and Amber Gross. And so really excited about Chase's new addition. I think that's their second child. And then we also want to acknowledge Annalee Powell and Ted Robinson, who were married this summer. or the spring in April. Some of you might have met Ted. He was at our social hour at convention. So, and then we want to respectfully remember colleagues we lost this past year, including Martisha Hall, professor of psychiatry at the University of Pittsburgh, who passed on March 18th, 2023. And so we also remember friends, loved ones, and colleagues not named at this time whose support and influence enrich our world, and really just want to acknowledge that. And want to acknowledge too, if you have a special milestone in the next year you'd like to share with the Society and share at this forum next year, please let us know. Let Dr. Barbara Andersen know. We're calling her Dr. Andersen. I'm sorry, Dr. Keaton. But let Barbara Keaton know. And finally, we're pleased to announce our newly elected board members for the coming year and thank those whose terms are coming to an end. You can see Stephanie Fitzpatrick, Markeisha Lee, Adriana Williams, Ravi Prasad, and Amy Williams. And then one's continuing terms, are they up on there? So Dr. Bradford, Ayers, Anderson, and Lumley. And then want to acknowledge Grant Heller, who's going to be our program chair for this next year, Ivy Snyder, who stepped into our social media committee, Aliana Carr, who's the postdoc representative in the ECP, Elise McKelvey, I think I got that right, with the Adolescent and Young Adult Interest Group, and Amy Cruz, who's sort of starting up our new consultation liaison interest group. Raphael, I think, is on tonight. He's our Student Advisory Council president, and so thank him for his work there. And I think, I can't read the slide, but I think that's all of our other, everybody else who's on the Student Advisory Council, just an amazing team. So thank you for all of them. And then just to acknowledge, again, people completing their term. Barbara Andersen, thank you again for all your hard work, both in the awards committee this year, but also the work you did with our long-range planning. Rochelle Hayes, Nancy Ruddy, and Ali Weinstein all completing their terms. Tim Smith, who's stepping down from the Fellows Committee, Stacey Obaid, who was our program chair last year, and Amy Grinberg, who is social media, is her term is end, as well as Jennifer Allen. So, and then finally, Noel, who was our student council chair last year, and that group that you can see there is from the last year's our 2023 Student Advisory Council. So yes, thank you. So thank you for joining us in our celebration of Society for Health Psychology members, their achievements. We welcome your ongoing participation. And please now to submit your presentations to the 2024 program at the APA convention to be held in Seattle, August 8th through 10. And so just a reminder, those deadlines for submissions are in January. So be thinking about it now. All right, we now stand adjourned. And I don't have my gavel with me, but yes, there you go.